Welcome everyone and happy Children's Environmental Health Day. A big welcome to the CEHN Annual Child Health Advocate Award presentations and panel discussion. We hope that you have enjoyed and gained a lot from our 6th annual CEH Day programming so far, and know that you will enjoy this portion of our planned events as well. For those new to Children's Environmental Health Network, we're a national nonprofit organization that has been working for close to 30 years with the mission to advocate for health, well-being, and safety of all children, especially those in highest risk, protecting them where they live, learn, play, and eventually work from environmental hazards. We launched Children's Environmental Health Day 6 years ago as a day of action for and with our youth. It is a day where we lift up positive movement forward in the field and leverage community national actions that are getting it right for our children. We would like to thank our Children's Environmental Health Day partners and sponsors for their incredible support and leadership. We appreciate you greatly. So let's get started with CEHN's 16th Annual Child Health Advocate Awards and panel discussion. We are here to honor exceptional leaders across disciplines, including youth who have consistently demonstrated their dedication to protecting children's health and health equity. Kristie Trousdale, CEHN's Deputy Director, will assist as our co-moderator today, and thank you, Kristie. We will briefly introduce each of our awardees with their name, affiliation, and a brief bio. And we do encourage you to refer to their impressive bios on our website and our social media channels. Each award panelist is going to give about 3 to 5 minutes for their opening remarks and their work related to children's environmental health. To get us started, Ms. Martha Berger with the Office of Child Health Protection at the U.S. Environmental Protection Agency is our 2021 Child Health Advocate Award recipient, and I'm so pleased to introduce her to all of you in that regard. Martha Berger has continued to be an incredible advocate for children. She started working at the EPA as a presidential management intern in 1984. She currently works in the Office of Children's Health Protection at the EPA, where for the last 20 years, she's been establishing relationships, both domestic, international, and working with partners in health and in environment to promote understanding, design, and run of programs that foster research and research translation on environment and health interactions during all stages of early life, from the reproductive period and throughout childhood. She ran the Children's Health Protection Advisory Committee as a designated federal official for many years and is the EPA manager of the Interagency Pediatric Environmental Health Specialty Units Program, a 25-year partnership with the Agency for Toxic Substances and Disease Registry. Congratulations, Martha.
Thank you, Nse. It's really a wonderful honor for me to be here today with this lovely, lovely parade of people. And it's a very special thing to be a part of this event today. So exactly 20 years ago at EPA, we decided to sort of relaunch Children's Health Month as in October. Kristie Whitman was the administrator of EPA at the time, and she wanted to go big. After the events of 9/11, and we hosted 11 events through that first Children's Health Month with Governor Whitman. And it was this very special thing for us, and we have continued to celebrate this month through the years. 6 years ago, when Nse launched Children's Environmental Health Day, I was so excited because the focus was more clear. And it just was a very special and nice way to celebrate a collaboration between government and an NGO in a meaningful way. So I just think that it's been a pleasure to work with you and others at CEHN all these years, and to walk the halls of conference centers at APHA meetings all over the country, and to work together in places all over the world. I think we were together in South Korea, Argentina, Thailand, and even Taiwan most recently. It's been a wonderful journey for me, and I've learned very much along the way, and I've enjoyed being a part of this children's environmental health community. To me, it's the most remarkable thing about this field are the people I've met along the way, who have been so special to me. People in my own office at EPA, throughout EPA, in our regional offices, in our program offices at EPA. And I've even gotten to work with a lot of other federal agency experts along the way. I was able to chair the climate change subcommittee of the President's Task Force on Children's Environmental Health Risk, which was born out of Executive Order 13045 almost 25 years ago. And I've gotten to do that again. We're reinstating that committee, and we're going to focus on both climate change, public health emergencies, and disasters. So we will get to work with experts from NOAA and NASA and all over HHS and HUD and transportation and energy. And I think it will be an opportunity to show the real power and force the executive agencies can bring to this issue. I also just wanted to say that you mentioned my work with the pediatric environmental health specialty units, and that has just been a hallmark of my work. I've enjoyed the people of those units for so many years. I've enjoyed working with them, learning from them, a more dedicated and thoughtful and creative group of people I don't think I've ever met in my life. And it's been a special thing to be able to work with the PACES all these years. So I'm looking forward to new horizons, to really looking into the policy underpinnings that can help us address climate change and health equity for children moving forward. Thank you for this opportunity and for this honor.
Congratulations, Martha, on a very well-deserved award. I'm pleased now to introduce our 2021 Science Award recipient, Dr. José Cordero. Dr. Cordero is the Gordhan and Jinx Patel Distinguished Professor of Public Health and head of the Department of Epidemiology and Biostatistics in the University of Georgia's College of Public Health. Dr. Cordero trained as a pediatrician, and he currently directs research centers that examine how exposure to environmental contaminants contributes to the high rate of preterm birth in Puerto Rico. For 27 years, Dr. Cordero served at the Centers for Disease Control and Prevention, where he focused on improving the health of mothers and children. During his time there, among many other activities, he served as founding director of the National Center for Birth Defects and Developmental Disabilities. Throughout his distinguished clinical and research career, Dr. Cordero has prioritized efforts to reduce health disparities. Dr. Cordero also lends his clinical and research expertise to advise the Environmental Protection Agency as a current member of the agency's Children's Health Protection Advisory Committee. So congratulations, Dr. Cordero.
I was muted. So thank you very much for this incredible honor. It's a pleasure to be here. And this honor really represents the work of many people, many researchers and advocates. We have been working in Puerto Rico for now over 10 years. And it was the community that let us know and that actually helped us put together a program to understand why preterm birth was such a high problem in Puerto Rico, with nearly 20% of the babies, 1 in 5, being born with too early, and with all the consequences of that brings. And it was clear that the reasons for this was not healthcare issues. They would not explain the high rise in preterm births that was seen in Puerto Rico. But at the same time, we learned about the many toxic waste sites that actually had been discovered by EPA in Puerto Rico. And in fact, Puerto Rico has more recognized EPA toxic waste sites than any other jurisdiction in the US. So we have more toxic waste sites per square mile than many of the well-recognized states that have similar challenges. And in the 10 years, we have learned that in fact, many of the contaminants that come from the sites together with local product use have been associated with increased risk in exposures such as phthalates and others. And And in the 10 years, we have shown, one, that they are carried by the water, and also that they're getting to and exposing pregnant women. And not only is it leading to preterm birth, but we also have early data showing that also affects the newborn baby and the neurodevelopment, early neurodevelopment of the baby. And if we, this has been also a team effort. It is now over 100 trainees that actually have worked in our Puerto Rico test sites for exploring contamination threats. And this really represents the collective effort and represents why it's so important that we all work together in all facets of research and community engagement to ensure that first we discover what are the challenges in terms of exposures, but also we can translate them into reducing exposures that are so serious for the pregnant women, but also for children. So thank you for this honor. And it is really the team, it's a Protect team. We are all grateful for this recognition.
Dr. Cordero, congratulations. And again, I want to extend my thanks as well. And on behalf of our board for your continued leadership. Your research is vital to the advocate work that we do. Thank you so much. I'm honored to introduce our 2021 Child Health Advocate Community Award to Ms. Catherine Coleman Flowers. Excuse me. As the founding director of the Center for Rural Enterprise and Environmental Justice, Ms. Flowers works to build partnerships across social scales, from close neighbors to local elected officials and regional nonprofits to federal lawmakers and global organizations to identify and implement solutions to the intersecting challenges of water and sanitation infrastructure, public health, and economic development. As an environmental activist, she continues to bring attention to the largely invisible problem of inadequate waste and water sanitation infrastructure in rural communities in the United States, while also broadening the scope of environmental justice to include issues specific to disenfranchised rural communities, while galvanizing policy and research to redress failing infrastructure that perpetuates social economic disparities in rural areas across the United States. Congratulations, Ms. Coleman Flowers.
Thank you very much for this award. And I too am honored to be amongst my peers here who are doing great work, and hope that this is an impetus for us to work together on projects, because a lot of our work is interrelated. I hail from Lowndes County, Alabama, which is located between Selma and Montgomery. And it's a place where its history informs the work that I do, because it was that history I was able to read and get the support to only a messenger, but the people that are doing the work are the people that are actually living in the community and dealing with these problems and issues every day. And I accept my award by just giving you a little bit of a life story about who I am. My mother had 5 children. I was the eldest of 5. And she was moved to activism very early, but she also organized women in Lowndes County who had been sterilized at Tuskegee, because they had a project there. A lot of people know about the syphilis study, but they don't know that a lot of women who went to John A. Andrew Hospital to have children were also sterilized. And she was one of those women, and she helped to organize women for that. As she did that, she gained friends and associates throughout the county. And later, a parent who now works with me on the wastewater problem sued the public school system because they did not make arrangements for children that had disabilities to go to school. She won that lawsuit. When she won that lawsuit, the school had to change and be able to accept those children. And my mother was hired to go and actually talk to the parents to encourage them to send their children to school. But the parents said, we'll send our kids to school if you hire her to drive the school bus. And she has to be at the school with them all day. So she became the school bus driver, and she also became the person who worked in the class as assisting the teachers with the students as well. Those parents today of those children are now the people that are helping me organize for sanitation equity in Lowndes County. The parent who actually filed the lawsuit is Charlie Mae Hawcom, who has been seen on the media around the country talking about the sanitation problem in the town of Hayneville, where she lives next to a sewage lagoon where the sewage is still running back into her home. And her daughter was one of the people that my mother recruited and had in her classroom at the time. Another young woman who is working with us, her brother Walter had Down syndrome, and Walter's sister is now one of the key organizers for wastewater equity and sanitation equity in Lowndes County. And all of them were part of the parasite study and very involved in that. So basically, I accept this award on their behalf, because without them, there would be no advocate. And a lot of the work that I'm doing because I listen to them, and they are real partners in making sure that we create the type of situation where children will not be exposed to hookworm and other tropical parasites that we should have eradicated, not only in the United States, but around the world. I thank you for this.
Congratulations, Ms. Coleman-Flowers. Again, another just example of exemplary advocacy and strength, and very well deserved. So I now have the pleasure of introducing this year's Media Award recipient, Ms. Sharon Lerner. Sharon is an investigative reporter at The Intercept, focusing on health and the environment. She exposes corporate pollution and regulatory failures with regard to environmental hazards, especially those critically relevant to children's health, such as plastics and pesticides, such as chlorpyrifos, and has provided insightful and in-depth coverage on perfluorinated chemicals, such as the PFAS family of chemicals. Sharon's coverage not only emphasizes the health impacts of these hazards, but also the disproportionate exposures and impacts to Black, brown, and under-resourced communities. Her fearless reporting has helped to inform decision makers and has led to actual health protective change. Congratulations, Sharon.
Thank you. It is such an honor to be among you all. I am having a hard time. I actually I was taking notes because I was furiously writing, because you're the people I write about usually. So it's nice to be kind of on your team for the day. Yeah, so I am not, I don't think of myself as a typical, children's health advocate exactly. I am, of course, a journalist who focuses on the environment, but inevitably by focusing on the environment, you have to focus on children. And that's the way it worked out for me. I am at a publication called The Intercept, which has been for me a unique place in that they, often when you I've worked for magazines and newspapers and radio, and often it's, make it 5 minutes, make it 2,000 words, there are these limits. And at this particular publication, I've only gotten encouragement to go deeper and deeper on the things I care about. And so I first began working for them in 2015 when I did a series about DuPont and its responsibility for pollution, water pollution with a chemical called PFOA, which back then nobody had ever heard of. It is one of the class of perfluorinated chemicals we now call PFAS. And that, it turns out, is a tremendous issue around the world for children. It's in the breast milk of women around the world. It's in water around the world and products around the world. So after that initial 3-part series that looked at both corporate responsibility and the relationship between DuPont and regulators in New Jersey and federal regulators, that was sort of how I got introduced to this publication, first teamed up with them. And then they decided, hey, why don't you come, why don't you cover what we're going to think of, we're going to call environmental crime. And so the idea was to look at environmental problems by calling the responsible into account, some sort of accountability reporting. So why did we end up with these problems? How did these air pollutants, water pollutants get where they were? And again, along the way, there are so many issues that I've encountered that affect kids most, and that's partly because children are developing and there are these critical windows when they're exposed, and also because of course they're smaller and so the dose ends up being bigger. But I've written about pesticides and chemicals and toys and all sorts of things that are about with pesticides and particularly how they affect development. But really, it turns out that kind of all of my reporting in one way or another pertains to kids, because again, kids are so susceptible to environmental contaminants. So some of what I've been looking at recently is problems within EPA and the new chemicals division, and how chemicals get onto the market and aren't always properly assessed, that kind of thing. Anyway, I could go on and on, but I won't. I'll just say that I'm really, really honored to be among you guys today, and thank you for having me here. It's an honor.
Ms. Lerner, congratulations. Among many lessons learned in this field over the many decades is that communication, but most importantly, effective communication about the needs to protect our most vulnerable is a skill and a vital part of changing the current narrative. So we really applaud you for being a part of that side of things and telling stories as they are, fact-based, and really helping a lot of us continue to move the narrative forward and the paradigm shift that's necessary. I'm honored to introduce our Child Health Advocate Award this year in policy to Ms. Kristin Schafer, who is the current Executive Director of Pesticide Action Network, or PAN. Before joining PAN in 1996, that's right, that's over 20 some years, Ms. Schafer worked for the World Resources Institute's Sustainable Agriculture Program as a communications specialist for the US Environmental Protection Agency and as an agroforestry extension officer in Kenya. And prior to stepping up as executive director, Ms. Schafer also was PAN's program and policy director for many years. Throughout her career at PAN, Ms. Schafer's work has focused particularly on protecting children from the harms from pesticides. One of her many roles included coordinating the global campaign to phase out the the ozone depleting pesticide methyl bromide under the Montreal Protocol, and as well as the international campaign targeting persistent organic pollutants, otherwise known as POPs, under the Stockholm Convention. Big congratulations, Kristin.
Thank you so much, Nsé, and to Kristie and the CEHN team. I am also so honored to be in this company and to receive this award today. This is an incredible group of change makers. I've long held deep respect for CEHN's work. I've attended many of your wonderful conferences like Martha over the years, and I've had the privilege of serving on your policy committee as well. I also get to work closely with Nsé in her role as a member of the PAN board, which has always been a great pleasure. As I was thinking about what to share today about my years of advocacy on children's health issues at PAN, two things rose up to the top. First, how powerful it can be to link the personal with the political in this work. And second, the critical importance of collaboration. So to illustrate the first point, I'd like to tell a story from my early years at PAN when I was, as Nsé described, representing the organization in negotiations under the Stockholm Convention on Persistent Organic Pollutants, or POPs. So this is the first international treaty to target an entire class of chemicals for global phase out, including persistent child-harming pesticides like DDT, lindane, and endosulfan. And the Pan-International Network played a key role throughout the process. So when I attended my first meeting in Bonn, Germany, I was still nursing our son, Connor. So as I pumped my breast milk that week, the fact that POPs chemicals were known to contaminate the breast milk of women everywhere in the world was very much on my mind. When I returned from that meeting, I wrote a piece calling out the State Department and the relevant politicians in Congress, led by then Senator Jesse Helms, this was a while ago, who were responsible for the obstructionist role the US played at that meeting. The US was pressing for policies that would mean that my son Connor and children around the world would continue to have nature's perfect food, their mother's breast milk, compromised by chemical contamination. In the end, we mostly won the battle over the exemptions that the US was pressing for, and the use of POPs chemicals has fallen significantly since the treaty was ratified back in 2001. Connor is now a young man of 22, and finding ways to connect the personal harms of pesticides to the policies and the political realities that cause them still motivates me in this work every day, and has often helped mobilize the PAN community into action. The second thing that's been central to my work at PAN throughout the years has been collaboration. We often say that this is deep in PAN's DNA as an organization, and that's certainly been my experience. Our two reports on children's health that I co-authored, A Generation in Jeopardy and Kids on the Front Line, were co-authored with PAN staff scientist, Dr. Emily Marquez, that reviewed and edited by many colleagues, both inside and outside of PAN, and made yet more accessible to community activists by our longtime graphic designer, Brenda Willoughby. All of the many articles, blogs, fact sheets, action alerts I've written on the topic of children's health throughout the years were reviewed, edited, produced, and distributed by our incredible communications team. Collaboration with partners outside of PAN is also key to our work. The recent win removing the brain-harming pesticide chlorpyrifos from food production nationwide, though imperfect, as Sharon knows very well, that win reflects years of collaboration, not only with our partners in the legal battle, but with coalitions in states across the country. We organized with these partners to win state-level bans to protect children from a dangerous pesticide when the federal government refused to do so. From the Protect Our Keiki Coalition in Hawaii to Californians for Pesticide Reform to the Smart on Pesticides Coalition in Maryland and others, PAN supported and collaborated with groups on the ground whose members were most directly affected by the continued use of this neurotoxic pesticide. So I accept this award with both deep gratitude and a healthy dose of humility, knowing that whatever I've been able to accomplish over the years has been made possible through collaboration with my colleagues at PAN and with our movement partners across the country and around the world. Well, thank you so much.
Congratulations, Kristin, and thank you so much for taking your personal passion and leading many victories along the way to help reduce children's exposures to toxic pesticides. Our 2021 NOW Youth Leadership Awardee is Ananya Sridhar, a freshman at Stanford University and founder of the Neptune Project, a nonprofit whose mission is to enable children everywhere to access safe and lead-free water. Ananya founded the organization when she was just a middle school student because she was moved to action upon learning of the Flint water crisis. The Neptune Project uses science and technology to develop tools that identify communities at elevated risk for lead contamination. And Ananya also goes the extra and critical next step. She secures funding to help these communities remediate lead hazards. Ananya is committed to inspiring other young people to create change in their communities and is building a network of students to act as environmental ambassadors, ensuring that this next generation of leaders are equipped and empowered to protect environmental and human health. Congratulations, Ananya.
Thank you so much, Kristie. It's really an honor to be here among so many accomplished leaders in the health field. Like Kristie mentioned, I've been working on this for 5 years now, so it's been a huge part of me growing up and learning, running the Neptune project. I learned as a 7th grader that lead contamination was an issue far beyond Flint. That was just a one-off case that made the headlines, but the 4 million children, there are 4 million American households with children who are exposed to dangerous levels of lead. And there aren't resources that are accessible to these communities for them to know that they need to be testing for lead. And after that, to actually test for it and fix it if there's a problem. So the Neptune project addresses this in 2 ways. One is an affordable litmus-like test. It's a filter paper that turns purple when in contact with lead ions in water. It's a really affordable and accessible alternative to traditional lead testing methods, which are cumbersome, inaccessible, and expensive. Excuse me. In addition to that, we coded a machine learning model that takes data from the US Census on a variety of covariate data, building age, income data, demographic data from these communities. And our machine learning model is able to predict the areas in the country that are most susceptible to lead poisoning. Because even if we have affordable testing, we still can't go to every building and test for lead. It's not scalable, it's not feasible, and it would take forever. So between these 2 parts of the Neptune project, we're able to create a really efficient way to streamline lead testing and catch as many Flint, Michigans before they blow up and become a Flint, Michigan. So we have prioritized zip codes from our data model that for all 50 states, which a lot of them don't have lead testing mandates in place. We're able to predict where the lead is, go to these communities, approach them with an affordable way to test, and fundraise for them to remediate their pipes if needed. So now in my 5th year of running the Neptune project, we are shifting from developing the science and the prototypes to implementing them in the field. We are trying to recruit a nationwide base of volunteers, particularly youth, because I really believe in youth advocacy for issues that affect youth, and lead poisoning is one of those where the younger you are, the more devastating the impact is. So we're really about building a youth network of volunteers who can A, collect water samples, B, educate their communities about lead hazards, because a lot of these communities don't even know that it's something they're at risk for, and C, be able to, if lead is identified, advocate with their local governments, local organizations, and people around them to encourage them to help with remediation and put a spotlight on children's health and safety, because in a lot of these communities it's neglected, which is what we saw in Flint. It was covered up by the government, and thus thousands of children have suffered brain damage that we don't currently have the medical capacity to undo. And so, yeah, that's our focus now. We're building as many volunteers as we can, getting test kits for as many of these communities as we can, and hoping to replace any lead hazards that are left in the US until there are none left.
Thank you so much and congratulations. I'm always extremely humbled to see our alumni, a growing number of alumni receiving this award in my honor, in my name, but you all have easily surpassed by your levels of achievement where I was at your age. And I continue to be excited about staying in touch and finding many ways to work collaboratively together on the wonderful array of work that you've mentioned. So big congratulations again to all of our fantastic award recipients. We're so honored to be in your presence and to continue to find ways for Children's Environmental Health Network to align and work and help to uplift your incredible strategies and work in communities. Now moving into our discussion. For the first question, each of you work towards improving children's health and health equity through different approaches. And you come to this work from diverse perspectives and backgrounds as well, and your life stories. Given your unique expertise and experiences, how do you feel that the confluence of today's significant intersectional issues like COVID-19, worldwide pandemic, climate change, racial injustice, and on, are affecting children's environmental health? Feel free to jump in.
I'll jump in.
you.
You know, when you asked that question, I thought about Pamela Rush, who's a woman that worked with us for quite some time. She was very poor. She lived in a mobile home, but she had 2 children. Her daughter was, hadn't even, when I met her, her daughter hadn't even become a teenager yet, but she slept with a CPAP machine because the home that she lived in was contaminated with mold and mildew. And they were straight piping when they flushed their toilet, it went out on top of the ground. As a result of COVID, Pamela got sick. She was a diabetic, but she couldn't fight COVID and she died, and she left 2 children that are now orphaned. And the impact that it's going to have on them and children throughout places like Lowndes County that are poor, and a lot of the poor communities where children lost parents, and children that will, I don't think we understand the mental trauma that it has created, along with all the other disparities, whether they're racial disparities, and of course the healthcare disparities. And this happened, Pamela's death happened in the midst of what was happening around George Floyd. So it's where a lot of these things intersected. And now we're also dealing with climate change events and disasters that are happening, because whenever a storm hits the Gulf Coast, and I live, you know, on a state that borders the Gulf Coast, we're on the east side of the storm. So I think about not only children like Pamela Rush's children who were in a trailer, mobile home, who have to leave, or children who couldn't go to school because of the pandemic. Just so many different, I mean, we were dealing with so many things, it was kind of overwhelming. And if it's overwhelming to me as an adult, just imagine how overwhelming it is to children. So at the confluence of all of this, I think we have to, what I try to do is instill hope, especially when I talk to young people on college campuses who say, how do I have hope when everything looks so tragic? And like, you know, the world is about to come to an end. And what I generally tell people, as long as we keep fighting, we have hope. And hopefully out of this, I'm inspired by the sacrifice of Pamela Rush, but I think that we have to make sure that there are no more children that are traumatized by all of these different environmental injustices and racial injustices that are happening in this country and around the world, so that they can have a fighting chance.
Thank you so much for bringing in Pamela's discussion and perspective, and very real story, which could be that of thousands, if not millions, for sure. Other thoughts on how you are personally seeing, or certainly are seeing within your work as well, these multi-synergistic implications? You know, I say often, you know, well, unfortunately, we do know children are pre-polluted when they're born. I mean, that's enough that should shock you. So children are already starting out this life, regardless of their zip code, social, economic, racial makeup, in a very negative sense, if you will. And then it then takes the nurturing, the loving, the nutritional aspects, and many other cognitive development, positive things happening for them to probably catch up to the potential of being initially on this earth and born. And then all the other multiple arrays, where they're spending time at home, where they're spending childcare time, if they even are able to go to one of those facilities, K through 12 schools, and on and on and on. And then you layer on racial injustice and economic injustice, and a worldwide pandemic where you can't even connect and physically see your loved ones potentially for very long periods of time. And every time you go outside, you have to be worried about, you know, a mask and, you know, all these other layers of stress, and seeing those around you of how this is impacting them. Any other thoughts on your perspectives of these realities of climate change?
Yeah, I have a thought. Oh, I'm so sorry. So in media, in journalism, people talk about, there's sort of this division. There's this idea that you can report on the climate, you're a climate reporter, or you might report on chemicals and be, you know, a toxics reporter, a chemical reporter. And, you know, and I have come to realize how absurd it is to attempt to separate these things. And I think what really brought that home was like reporting on plastics and realizing that, you know, these are obviously sources of chemical pollution from the production to the disposal. There's all these, issues of how the contaminants that go into plastic and leach out of plastic get into our bodies. And at the same time, it's impossible to look at plastics production and not think about the fact that these are made with petrochemicals, that these are made from petroleum products, that the production, has huge climate impacts. And so, just like it's impossible to tease these things out. And it's also, and it becomes somewhat frustrating. The siloing can be really, I think, counterproductive in terms of news coverage and just in terms of policy approaches too. And I was recently, I've been writing about a chemical called ethylene oxide, which is another petrochemical and is a carcinogen, also affects children and adults as well. And I was calling all my sources activists who have been working, in particular, one activist who is working on stopping a Formosa plant in Louisiana. And when I called her, she couldn't talk because basically a hurricane had come and she was dealing with a tree that had fallen on her house. And you just realize that, again, these things are inseparable. And it's not just like, the intersection is it's not just like an oversight. It's foolish and dangerous to ignore how they're connected, is I thought.
I would also, just listening to Sharon, I'm actually hopeful because at least we see that there's some groups like NIH and the National Institute of Environmental Health Sciences through the Superfund Program. It's actually trying to build those bridges. And, NIH is well known for doing biomedical research, but not engineering research that's supposed to be done by someone else. But actually, the fact that that's in the Superfund Program allows and actually requires to have engineering working together in projects with biomedical researchers actually has done a big difference, like the work that we are doing in Puerto Rico. One of the major sources of the pollution that we had, like with persisting organic pollutants and particularly phthalates, is from the water, and the water used for drinking. And first we have identified ways to try to reduce that, but our colleague Akram Al-Shawak have developed a system that actually can eliminate those chemicals through an electrophysical method that actually we're beginning to test in Puerto Rico. And the idea of actually an engineer working in something like that would not have happened if it wasn't because we were put together and we had to look at the same problem, and is we have too many pollutants. How do we work on in one, removing them, and ensuring that exposures can be reduced? And so we need to have more work and more research funded, that rather than being focused on one area and say pregnancy, but actually looks in the broader sense, so we can go from understanding the environment to what happens and what's the impact of these chemicals, but also how can we remove them and make sure that we don't have the number of percentage of babies that are born that already are very exposed can be limited. Eventually we can go to a real healthy environment.
Thank you so much. And along these lines of promising opportunities, right? The challenges are many and they have been there. I would also add, there are wonderful partnerships that continue to develop and emerge that help to leverage all of our collective ability, right? We can't do it by ourselves. The federal government can't do it by themselves. Communities aren't able to do them by themselves. It's our collective. And I think, Catherine, you spoke to this earlier, but any other promising looking forward opportunities, solution-oriented efforts that you're seeing that you'd like to lift up?
Yes, for an example, we've been working in collaborations with NRDC in the interest of transparency. I serve on their board, but we had the opportunity to go together to Mount Vernon, New York. We were called there because people were dealing with wastewater problems, with sanitation, with sewage coming back into their homes. And Mitch Bernard and I went there together. And I think that that's an example of the type of collaboration that's going to be necessary to bring it to the forefront. And after going there, and he was just as shocked as I was, not shocked because I've seen it before, but I was shocked to see it where I saw it. And we ended up writing an op-ed in the New York Times that published about a few months ago, talking about that particular issue. We've also, this morning even, I was in a conversation with an engineering professor at Stanford, and we pulled together a collaboration with people at Baylor and with our organization to talk about applying for an actual EPA-funded grant together to work on wastewater and sanitation equity issues and solutions. So the type of collaborations that we're seeing occur, even my move to Madison, Alabama, the reason why I moved to Madison, Alabama is because it is also the home of the Space Command here in Huntsville. The Marshall Space Flight Center is there, and we know that they're treating drinking water to wastewater quality. Drinking wastewater to drinking water quality in outer space. And what we like to do is bring together people from the community that are dealing with these kinds of issues and let them sit at the table, changing the engineering paradigm where there's a true collaboration and trying to come up with something that will work, because we know that with climate change, a lot of the sanitation systems of yesteryear and yesterday are not working because we're getting more and more rain, and water is a part of wastewater treatment at this particular time. So we're hoping to, within the next 5 years, to come up with technology that works. And that is, those are just some of the potential, some of the collaborations that we have going on. And I think that this collaboration is going to lead to the solution. I got two other things that make me hopeful. One is the White House Environmental Justice Advisory Council. There has never been on this level, the executive level, where we've had to have brought together true activists. These are not people that were just handpicked and ordained as activists. These are people that have been out there for a very, very long time, that are serving in a capacity to advise the executive branch. It's historic. You know, there will be bumps along the way because we're building the car and driving it at the same time. But the fact that it's there and that this administration feels that environmental justice is an issue we should tackle, whatever comes of that will be more than what we've had before. I think that's a great thing. And then the second thing we're seeing in the financial world, more investment in the kinds of things that will bring about what we're all talking about. There's a new organization that just launched a new investment arm called Galvanize that's headed by Tom Steyer, that's going to be looking at focusing on EJ communities and climate justice communities, looking at solutions to these problems so that people like Cheryl Levine that our Sharon today just mentioned wouldn't have to worry about those petrochemical plants that are down there in Cancer Alley that are creating all these problems that we're talking about today. And the impact is having not only on the adults there that are having these high cancer rates, but I'd like to also see what kind of cancer rates the children are having too, as a result of being exposed to these petrochemicals. But the fact that we have these type of collaborations and we're all working together, I think we're a lot closer to the solutions.
Thank you so much.
I want to jump in with a couple thoughts here as well and say too, and you talk about opportunities, and the first that comes to mind actually goes back to your first question about kind of all the intersecting issues that we're facing right now. And one of the things we saw is that the pandemic actually really underscored the need for a new vision for our food system that's more resilient and that's rooted in justice. Early on in the pandemic, we saw how fragile the food system is and how unjust, right? With farm workers recognized as essential workers that they've always been, but having to fight for basic safety measures and protections. And then the pandemic also broke some pretty significant links in the food chain, right? And households across the country turned to small local farmers to source fruits and vegetables, and creating wait lists for existing community-supported agriculture farms, offering lots of new opportunities for many small sustainable farms, including many farmers of color, some who hadn't sold directly to customers before. So the opportunity is to put policies in place that really support and help grow these more sustainable local food economies, which we know are more resilient in the face of crises like the pandemic and also in the face of climate change. And the challenge is overcoming the pressure from the pesticide industry and other big ag players that, you know, are wanting to keep things as they are. And then another opportunity that I wanted to lift up was that we're excited about is the Protect America's Children from Toxic Pesticides Act. So a potential federal law that we're hoping will be reintroduced under this Congress. And passage of this bill would represent a huge step toward bringing our system of pesticide regulation basically into the 21st century. We're that far behind. And really shifting EPA's accountability away from the pesticide industry, where it's been for decades, and toward protecting children's health and public health and the environment. So those are two opportunities that we're excited about moving forward.
Yeah, adding to both of those questions, having worked with large data sets and doing data analysis on them, I think that's been a great tool for me to understand how a lot of these things intersect and how intersectional identities also can compound to great disadvantage when it comes to things like the health and environment you're into. And so I think being a young person, having grown up in a digital age, having access to all these tools for data science data, you know, as a really young person has changed the way I think about it. And I think that's a great opportunity of leveraging all this technology, including machine learning, to effectively tackle these issues. And, you know, the beauty of things like artificial intelligence and machine learning is that they don't necessarily carry in a bias with them, and they're able to make connections between data, you know, without prior knowledge so that we might not think of. So, you know, if you have mapping technology and you see, I don't know, maybe there's a highway somewhere nearby, that's something that you might not have thought about, but a machine learning algorithm can take that and say, this area is at risk for something. And I've seen how effectively that works for just the issue of lead poisoning. And seeing how my model has learned and adapted over time makes me very hopeful about how that same strategy can be applied to many other public health issues. And so one thing I like thinking about is saying, hey, this is a piece of technology leveraging data for social good that has worked for lead poisoning. How do we apply that to all these other fields and collaborate between fields and, you know, find really effective strategies for leveraging all this cutting edge technology we have around us that's constantly developing and learning, and using that to solve our problems in the most efficient way possible.
Excellent.
That's really encouraging to hear about. And I guess if I might sort of try to bring together these ideas of intersection and collaboration, I think the opportunity here for children's health for today and tomorrow really has to center on climate change and health equity. I think we have opportunities to do as Ananya says, and advocate that, teach youth that about the things that are going to affect them and the things that will affect them, and start now, and don't hold back. We want to pursue STEM, but we also want to raise up poets and artists and dancers. I've become very enamored of literature on climate change, and ideas about eco-anxiety are gaining more and more traction. These things are real, and our children are going to have to live with them. Today, the stats came out on the number of kids that have lost a parent to COVID. And of those kids, it's a huge number, 2/3 are minority kids. This inequity is real. It's going to happen over and over and over again here in the US and the world over, in our urban areas, in our rural areas, in our tribal communities, everywhere. We have to pay attention. I think we should work to build a system that educates kids about the things that they are living so that they are well armed to take on these issues as they grow.
Thank you so much, Martha. I thought that was a very good summation, and I really appreciate all of you for so many reasons. Just quickly, in summary, Catherine brought in Pamela's experience and how mold and mildew exposures in her mobile home and the need to move and transition her family, mental and trauma and stress, perpetuating through her family and her children having to then mourn her eventually in her death and still deal with a multitude of other community related very serious issues. And then Sharon, you talked about the issues being intrinsically related, the cumulative impacts, making it impossible rather to tease these out. And after all, what's really the benefit when we're really just trying to aim for overall protection of all, especially our most vulnerable, like children. Jose, you brought in a very hopeful opportunity type of a situation, calling in on the National Institute for Environmental Health Sciences Superfund Program that's working to build bridges and has been doing so for decades. Dr. Bill Sook over there, we know very well, and many other colleagues, they work extremely hard to bridge these type of collaborations in a true, genuine way at the community level. And also elevating the need to work more and to have more resources that are dedicated to identifying and removing these chemicals once and for all. Forget about trying to manage them. Let's just avoid their overall experience and entry. And with that, I'll add, you do need to get very serious about the economic drivers of our dependency on fossil fuel production and many other harmful chemicals. Catherine also talked about work with NRDC and in New Jersey and sewage coming into homes. I actually got my start at the Children's Environmental Health Network in Southeast DC, working on very similar issues with raw sewage literally leaching into $500,000 condos in Southeast DC and still kind of being under the radar at that time, and how long it took for families with asthma and high cancer incidences and other negative implications that were starting to, in essence, cluster because of those very harmful exposures. And the need to have true collaborations for climate solutions. You all echoed that a lot. Also lifting up the White House Environmental Justice Advisory Council, first ever historical advisory ability to the executive branch, understanding that is not going to be smooth by any means, but that's the whole benefit, to truly work in partnership, the ebbs and the flows, the negotiations, but understanding that everyone is working towards the same goal of protections for all. Galvanize being mentioned as an investment strategy in the creative ways that we all need to think about capacity and bringing and building in capacity at community levels. The connections to cancer rates in the petrochemical industry, and again, not shying away from those realities, especially when that data and those realities are right there in front of us. Kristin, you talked about the need for a renewed, revitalized food system and elevating Pan's leadership and yours and many others in the Protect America's Children from Toxic Pesticides Act. And also the great discussion about leveraging technology available, including machine learning and artificial intelligence strategies that can be applied and can be offered as resourcing to a range of public health issues, phenomenal. And the need to focus on health equity and climate change, teaching youth about these issues, that their leadership is vital, but that also that of the many issues that can and will continue to impact them, and the ability to change course with the political will or the garnered will of many. So with that, it's a lot of heavy work, and it takes a lot of incredible champions. This is not easy. If it was easy, it would have been done already. But again, we all stand in such a humble fashion with you and our many award recipients prior, and just with deep gratitude, thanking you for the way that you stand up each and every day. It's hard. You're still humans. You are all still living through the COVID pandemic. We wish everyone health and well-being as we continue to emerge out of this. And we at Children's Environmental Health Network stand ready to work with each and every one of you in doing whatever we can to put children first. Thank you so much.
Thank you.
Thank you.
Bye-bye,
Thank
everybody.
you.
Bye, everybody.